Please, remove that label. Then you pay for it. Welcome back. Yes. According to reports that we read, the Lagos State Environmental and Special Offense Court sitting in Ogba convicted 6 traffic offenders arrested by the convoy of the Lagos State Governor, Akinwumi Ambode, in Ijora, Olokwa area of the state while driving against traffic. The motorists were ordered to forfeit their vehicles to the government, in addition to payment of the Marwa drivers and the Okadas 5,000, 30,000, and then the car owners had to pay 50,000 to pay 1 month, or they have the 1 month imprisonment. Now, what are your thoughts on this? It's your view. You can call us on 070-8066-8014. You can tweet to us at TVC Connect. That's 2 C's. TVC Connect. Please hashtag your view TVC so we can get your tweets, please. Right. So, what do you think about the idea of people driving against traffic and then, was it a one-off thing, or is there a law that actually says once you drive against traffic, they forfeit your car?
Yeah, it was a few months ago, after the governor came in, they re-released the law, stating clearly that if you're found driving one way, you're going to forfeit your car, and it was publicized over and over again. So I think people knew about it.
I didn't know.
However, stating clearly what the judge Tani Momo said, there were 4 cars and 1 motorcycle and 1 keke napep seized. The 4 cars, the tricycle, 4 cars were charged to pay 50,000 naira in addition to forfeiting their car or spend 6 months in prison. For me, that's like kileju. Because you lose your car, you pay 50,000 naira. If you cannot pay 50,000 naira, then you spend 6 months in prison. Then they said the bike man should pay 5,000 naira or spend 1 month in prison. And then they said the tricycle person should pay 30,000 naira, forfeit the tricycle, and still spend 1 month in prison. The punishment, I know that you're trying to make an example, but it is too harsh. I know that it is wrong to take one way, and it causes major traffic. The major culprits are usually bikes and
it doesn't cause major traffic alone. It causes accidents.
Yes, a lot of
major accidents. Because you can imagine you are going on an express road, and
all of a sudden,
all the cars are supposed to be going this way, and you now decide to come back this way.
YK, in most cases, it's police officers.
Listen, no. Police officers are...
We know that.
Yes. We all know that. They always commit offense. But normal people as well.
And public transports.
Commit danfos, bicycles, tricycles. They all commit the offense.
Interestingly, now, YK... Sorry, so go ahead. Let you finish. Go ahead.
I think that... where I agree with you that the season of the cars is a bit much. They must be punished. That 6 months is too small. You should give them like 6 years. Yes, 6 months.
No, I can.
Then we have their cars.
Yes, that's a real killer. What is that?
Because what are you saying? Wait, let me ask you this question.
6 years, wow.
If you are coming, you are going on normal road and you are going at a normal 100 kilometers an hour, and this car is coming and you cannot avoid, and then you jam, and there are lots of lives. What do you think that person should? What do you think should be his
totally agree with the forfeiting.
Because listen, he has killed people because he's taking the wrong route. What do you think his punishment should be?
Well,
I'm directing it tomorrow. Then you.
That is different because now somebody has died. So we can now either can be murder, can be manslaughter, however. Then that's the proper case. But where there was actually no loss of life,
that one is attempted murder. That one that they are coming on the wrong is attempted murder.
Please, I want to just say something. Okay. Because when I said Kileju case, when you forfeit your car, I feel that forfeiting car is a proper punishment. You lose your car. If you follow one way, you lose your car. But when they don't sentence you in addition to prison, some person you've already lost your car. You might not be able to afford 30K. You just spend 6 months.
No.
The forfeiting car is one. That one is done.
Yes.
The either or is paying money
50 or
prison. So if you cannot afford 5K, you will now spend a month in prison. What would happen? Do you know how many lives you've lost in prison? Over 5K.
Your family might even die. No food.
I think that it's better. Our prison is over full already. Let's not bother sending them to prison. Take the car. If you take one way with your bike, take the bike.
Well, when you take the car
and sell it and auction off to them, the government makes money.
How do you want them to survive when they come out of prison?
The next time, don't take one way. Next time, don't take one way.
But I don't even think taking their car makes sense. I'd rather you just seize it for some time and give them
back.
Seize
it,
we don't have space to save them.
Yeah.
No, for me, both the keke, the tricycle, the motorists, all of them should go to the same sentence
Thank
imprisonment.
you. All of them.
Not that because you are keke, you do 1 month.
Thank you.
Because you are car, you do. It's the same thing.
The same
if
thing.
anything wants to happen today,
Like 5 years.
yes, it's the same thing. So I think the because the truth is that the people that are the most culprit in this situation is the tricycles and the the motorcycles.
Yes.
So it is not a function
Public
of saying that
transports.
because and buses, commercial buses. So it's not because they are driving tricycle, then they should pay lesser money. Everybody should pay the 50K fine, and everybody should go to the 6 months imprisonment. That's number one. Then number two, before this, some of these people have valid reasons to go on one way.
No, there's no reason.
Hold on, YK. Hold on.
Wait.
Now, especially for road constructions happening around that Ijora
that one,
area,
they won't arrest
we
you
know
now.
that hold on. We know that some of them, because the day that Governor Ambode arrested those people, I was watching the TV, and the woman admitted that yes, that she went on one way, but I think it had something to do with what's it called, the bad roads in that area. So for me, before our governor comes out to say that these are the rules and regulations, you see, there's always a part for everybody to play. Government should ensure that these roads, you have done it, that these people don't have any excuse anymore. Because if you want to look at it, some of them have valid reasons for taking. No, it's true.
They're
They won't
not
arrest
proper
you.
about detours.
Yes,
or
they are not proper detours, they are not proper whatever. So some people have valid reasons for taking one way. So if the government have done all their own bits to say, okay, the roads are all properly fixed, then you cannot put that kind of stringent punishment. I will give you 100%. You can give me 10 years imprisonment, sir.
Okay, all right.
They wouldn't arrest you.
There is no valid reason. There is no valid reason if there is no diversion. If they have not diverted you, then everybody will go on that rough road. It's not it's either you park your car or you go on the rough road. That's diverting because the road is bad. It's not an excuse because the person coming on in the opposite. You see, let me tell you, I drive and I'm telling you how the thing affects me. When I see a car, and I'm going at maybe 100 kilometers, then a car is coming on the. And I just think this is so risky. It's so bad.
Let me come to this angle because the
Or
truth
there's
is
traffic.
a lot of cars actually usually follow the commercial buses because they assume they know the roads
And they
know
won't
the
arrest those
diversions.
ones.
So they don't arrest those ones. So maybe while you are getting the roads done, we should also train these commercial bus drivers.
Yes.
Even maybe sack all of them. And get fresh people.
And can I also add?
I don't even think they're trainable because a lot of them actually you train them.
Yellow buses, you can't sack them. They own their buses.
Can I also
So
add?
you
Can I
can't
also
sack me
add to
from
what
my
you're
boss.
saying now? Now the number one what's it called? Number one culprit in this
Is the
matter
police
is the
officers.
police people.
Ah.
Now we were going
stop
on.
the
You know the government has put a law that no more convoy and all that. I went to Osun State to visit my friend's son in school. Went to bring him back from school. And on our way she was telling me that she knows this person. He's a popular artist that lives in Omole. I said, are you serious? With heavy presence of military mopo and all that. They were busy clearing the road and, going on with sirens and all that. People will follow suit. You understand? Truly, when we got to the estate, she wanted to prove a point. She drove past that place and she showed me, look, is this not the car we saw and all the convoy we saw on the road? She said, this is it. So you see, the number one culprit is also the people that are enforcing this law. The police people,
100%.
100%, they are the ones that always do these things. Most times you see them, it's not an emergency. You're not trying to, it's not like maybe there's a robbery and you're trying to pursue. Just because you cannot, you can't wait for the traffic to clear. You will see the police people, they come out of the road and they take one way. So it cuts across. Also, if Governor Ambode is arresting what's it called, the normal motorists, they should also arrest the police personnel. They should also arrest them.
Arrest
them and convict them as well.
When it comes to back to the road diversion matter within Lagos, and I'll say this because when I was traveling to Benin, I was actually almost tempting my husband to go on one way because the road was terribly bad. But at a point we saw FRCN, and I must say that they did a fantastic job. They stopped people from going on one way. While I was coming back, I noticed the problem because when you're traveling and you just see one random car coming to meet you, there is no excuse for it. Everybody go through the bad road while we're suffering it together, and nobody should be exempted. Yellow buses, yellow taxis, police, everybody should face it.
See the police.
Also, the governor in this account, you can't use corporates and use innocent. They're not innocent, but regular motorists, because we know that people that do this most of the time are yellow buses. So yellow buses should have been the first example you are making in terms of this crisis, the
No,
yellow
those are the
buses.
people
No,
he
it's
caught.
unfortunately he
No,
caught
they
them
were the people
red-handed.
he caught.
He caught them red-handed
They
by
were the-
himself.
You see, look, let me tell you, I have seen drivers, I've seen the way they drive, and it is unfair. Let me tell you, it is unfair. It is unfair to the person who decides to drive
Right. Yes.
within the law.
Yeah.
It is unfair. And I'm telling you, if somebody is coming in the opposite and you hit the person,
Anyway.
and any member of your family dies, you will want that person to go for the death sentence.
I think
not
the law
just-
should be
Let's
adjusted
take some
though.
tweets. Let's take
Let
some
me
I'm
check
tweets.
some
waiting for you
tweets.
to load.
It says the punishment is too much though. We Lagosians are not afraid of traffic laws. You see, they say they need to seize their driver's license and also pay money for their misconduct.
They will still drive. That's
It-
using
they
driver's-
will-
that's
who's going
using
to check for your
driver's
driver's
license. It's a
license?
foreign concept.
It is high time the government draws a line because of the nonchalant attitude of Nigerians towards the rule of law. You see, these are people that are.
I have
thinking
one
like me.
final
To lose a car,
Yeah.
to lose a car, prison sentence for me is too harsh. Impounding the car with heavy fine will be
Yeah.
better.
Yes, impounding is better. We need
Because
a
you know why? Mixing them with criminals in the prison,
yeah.
you don't want to know if that person comes out after that 6 months, the person will turn to proper criminal for you. You know, because it's not like we have proper prison
Separation,
facilities that you can
yes.
separate. Okay, this is what
You can make
because-
their own prison for them.
Yes,
Why
Wow.
can't make their own prison?
No.
Car
You can't make their own
offenders
prison.
prison.
YK.
No,
There was
they
a
By the
can't-
time you
no,
go
but
there,
I can't hear anybody anymore.
The solution I'm trying to point out is that, you see, instead of that prison sentence, they can change it to community service. Do you
Yes.
understand? Do something.
To run away, there's no way of tracking them
No,
down.
that is why, you see, that is why, which brings me to my other point. We need to work on our data to
We
ensure
have
that
already.
every human being, down to your village, they
have.
know your no,
They
it's
use
true.
data again.
We
They
have.
have got your BVN. They
They
have
have
got
BVN,
your
they have
phone
everything.
details.
So I'm saying
until-
that if you now have that, you are saying they will run away.
run
They
away.
have it already.
I like
I
to
have my
suggest
BVN.
something.
They tell me that my community service to sweep. I'm not sweeping.
No, with your, if they hold your BVN,
Eh.
you
If they-
cannot
if
withdraw
they
money.
block your
You will
account.
sweep. Mariah,
You will
you will
sweep.
sweep for the next 6 months because they've blocked your account. I feel that
And they will see you on the highway in front of the governor's office sweeping every day. You will know after the
All right,
6
we have
months.
to round up, we have to
you know,
round up, we have
On
to
a
round
lighter note, I love the way the thing just went so fast. The fast track of this process. Can corruption also just be faster? They just sentence them.
No, because you see, we have even forgotten just that the former governor said that all of them should go to the mental home.
Yes.
That is one of the laws that should be
Yes.
there.
Yes.
That after serving their prison, they should go for assessment because
Yeah.
they
Be sure
cannot
they are
be
now
correct.
okay.
But they said that our doctors too are not totally very
Okay,
yeah,
so even the doctors
it's
say
difficult
need
to hear.
evaluation.
So we need real evaluation, like NLP kind of
God
processing.
will help us.
All right, let's take a quick break. When we return, we heard that Lassa fever might be Taraba State, back in the country. Taraba State in the northern area of Nigeria. So when we come back, we're going to learn more about what exactly is Lassa fever. Stay with us, we'll be right back. Welcome back. Lassa fever is an acute viral hemorrhagic illness caused by the Lassa virus. It is usually transmitted to humans from contacts with food or household items contaminated with rodent excreta. Now, the disease is endemic in the rodent population in parts of West Africa. According to reports, the Taraba state government has recently confirmed the outbreak of Lassa fever in the state. The Commissioner of Health, Innocent Vakai, who confirmed this, said one person is dead, 2 others are quarantined. Before it becomes an epidemic, how can this be controlled? Joining us on the show is a public health specialist and senior lecturer of the Lagos State University Teaching Hospital, Dr. Olalekan Makinde. Welcome to the show, sir.
Thank you very much.
Good to have you. How's your wife doing?
Very
My
fine.
regards, sir, because you know she watches the show.
Yeah.
All right, so Lassa fever, we know obviously it's passed from the excreta of animals, especially rats, to humans. And from what I read, you can actually inhale it from, actually I don't know from dealing with rats, but how do we prevent this from being
particular rat.
Yes.
There's a particular rat actually,
yes.
not all rats.
Yes. We have what we call the multi-marmot rat,
Yeah.
which scientific name is Mastonemus natalensis.
How do you know them?
Well, if you see the rat, it has many like breasts. That's why they call multi-marmot.
Oh.
They are very dark in color, and we have a lot of them in Africa, especially West Africa.
Do we have them in Lagos?
I think we do.
Oh my goodness.
We do.
My cat is dead.
Maybe you should buy another one. You know, so this is the major organism. This is called a zoonotic infection. That's a Lassa fever. That means transmitted from the rat. Now, when the rat gets in contact with the food item, whether it's a feces or urine, this is the primary source of transmission. And if you want to know more about that, you can see the way we preserve our food is one of the important things. If you're traveling along the road, like some people that travel through the festive season, you will see people spreading gari and all that on the floor. So these are the things. And that's why, for instance, Edo State actually is what we call the epicenter for Lassa fever. That's why we have Irura Specialty Hospital there. You know, when you travel along that place, you see that there's a lot of food being spread on the way and all that. So those are some of the things that have been implicated in transmission of Lassa fever. So talking about Lassa fever, we are still going back to the important and the basic thing, hygiene. So if everything is well done and everything is well taken care of, then there will not be Lassa fever. So that is the primary route of transmission. Okay, so either where somebody gets in contact with the feces or the urine of the rat, but also there are some documented evidence that in healing, even in healing also, the urine and feces of those rats.
Exactly.
So once you can prevent a rat from your house, you are free from the...
Because we have a lot of viewers watching us from the north, so we know that they will be very concerned about this outbreak. Now the thing is, do they go around with those masks and not being able to breathe, or
No.
I mean, how do they take that extra caution to ensure that?
It's not basic, just like what we have doing the Ebola thing. It's the hygiene. If we have everybody hygienic, if we keep the rat away, then we are all free. But that's the primary route of transmission. But there's also a secondary route, which is human to human, as she just mentioned.
Because I wanted to ask if it was contagious.
Yes, but it's not as bad as Ebola. In Ebola, you don't want to shake anybody and all that, but that does not happen in this case. It has to do with secretions, blood, feces, blood, and all that. Yes, it has to do with contact with secretion from somebody who's already infested. Okay, so maybe the person's urine and all that.
What of sweat?
Sweat. No, the evidence is not so strong for that, but any secretion actually could cause it, because the virus is in the secretion. So somebody else also have a cut or something, then the secretion get in contact with that, and that can transmit it.
So as a public health person, do you think that our medical team up north or generally are prepared to protect themselves? Because I read that the fear now is that the doctors and nurses themselves might be exposing themselves to Lassa fever before knowing it is even Lassa fever.
Thank you for that question. I'm happy you asked that. That shows us how much risk doctors have to go through every day. You know, when you take note that the doctor gave me 5,000 hazard allowance for all those risks, and because at the moment now the doctors have to take extra precaution. Now the thing is that most times the facility to use are not there. Now if in Lagos State, for instance, I had somebody related to me who came to the hospital, even in Lut, even I work in Lut, I'm a senior registrar in private community health, and there was no space. That's in Lut, the center of economic center of Lagos, of Nigeria. So imagine somebody that is in other cities, they cannot even access to the healthcare. That's a major issue. Now, for the doctors themselves, they don't even have what it takes to protect themselves, because the people that really get they are very high risk. The occupation is doctors, because yes, and nurses too, and of other health workers, not even doctors, and other health workers like the maid in the hospital and all that. Because if you remember, the fever, Lassa fever was first described in 1969 in the village called Lassa in Borno State. And how was it described? 2 nurses died. So every time there's an outbreak like this, a doctor or nurse
Usually
is right, to get...
Okay, yes. Well.
I was watching TV yesterday, and one of the health workers, the government, I think health commissioner in Taraba was talking, and he said that, you know, amongst the 2 people that were quarantined, that one was recovering and, you know, was doing well. So I was wondering, is there like, for instance, first of all, like immunization against Lassa fever? And if there's no immunization, is there any cure? Can it be treated?
Yes, Lassa fever is quite better than Ebola. If you want to choose one of the two, you want to choose Lassa for Ebola. In Ebola, for instance, the case fatality rate is about 70%. People that have it, 70% are going to die. But in Lassa fever, it's just 1%. And yeah, Lassa fever, the good thing about Lassa fever in a way is that out of everybody that is infected, only less than 20% are going to show any symptoms. So the Taraba you are talking about one person, and even I think Naka said it's 3, not 1. 3 people dead. I'm sure that by that 3 people dying, a lot of hundreds of people have contracted infection. Yes, but only few people are going to show the symptoms.
But what's the treatment for it?
Yeah, we have an antiviral drug, ribavirin, that is used for treating. Lassa
So you
fever.
can take it preventive. You can people can go there to get immunized or
there is no evidence for preventive. Now the thing about Lassa fever is this: once the person has the disease, is diagnosed, and this is where the problem is, and that's why the NACA chief was talking about that. If you start ribavirin early enough and you do what we call supportive treatment, the patient is like not going to die. Even out of people that show symptoms, just about 15% are going to really be very bad. And out of all the people that even show symptoms, and although people that show symptoms, one funny thing about it is that when they recover, also statistics show that about 25% will have deafness.
Whoa!
Yes,
Whoa.
That's it's a long-term complication.
No, sorry, Tokwe, follow. Like for instance, now you were saying if they know early enough and they start the treatment early enough. When you say people don't show signs, now is there something that symptoms?
Yes.
How do I now look out to say, okay, this might be Lassa fever, so that I can treat it early and detect it early?
This goes back to our health system in Nigeria. People do self-medication, and this is a problem. So whether it's Lassa, whether it's Ebola, any other thing, somebody have fever, and the next day I have malaria. And that's why when I'm seeing a client and the person tell me I have malaria, I'm always very upset about that.
we can't blame
Because
us.
how do you know?
Like,
I'm not a doctor.
I agree with you.
It's always malaria. After you rush to the hospital,
It's not always malaria.
You now get there, they'll tell you it's malaria. You just assume
Well, let him finish.
The doctors too are at fault because when you go to the hospital, they won't test you. They will just it's malaria. When you go back to malaria, they will say it's typhoid.
You can't blame us.
I have malaria or typhoid, so I blame doctors as well.
I blame doctors as well because I have had that experience. You know, I insisted that run a blood test. You don't have to just look at me and conclude that because I have temperature. Because you see, now, who is the person checking the doctors? To make sure that this doctor is qualified to sit down and see patients.
Yeah, those are the issue. And that's why we have to our health system. We still go back to our health system. Normally, according to WHO, you don't diagnose malaria without a test. So what you said is very important. Okay, so even now, even in the villages and all that, we are having random kits that you can use just to check. Yeah, to check. So you're not supposed to just do a diagnosis without doing a check. And some of the doctors, that we go back to our government, there are many people out there practicing. I know somebody that was running a center who was not a doctor. Yes. Some years ago, and when the person is in big trouble, yes, calling me on the phone and all that. So there are many things out there, but a properly trained doctor, for instance, now you don't get your license renewed without having to present some training over the years. We have it now in Nigeria.
Oh, that's good.
Yes, you have to have some CME before you get a license renewed. Not just one man who has not been to any course in the last 20 years and is running an hospital and
so
all
can
that.
I enter any hospital and demand for the doctor's license?
Yes.
Can I see your license?
Really?
You can demand for the for the year.
No, they shouldn't put it up now on their website.
That should be in the hospital.
Every
Yes, it should be in the hospital. That should be showing that this doctor is qualified to treat.
Yes.
And when a person comes to the hospital with some of these symptoms, the person have to be diagnosed appropriately. Because even the doctor is at risk. If you are touching somebody who has Lassa fever.
I know we're having issues with our phone lines, but I think they've been able to fix it. So let me take a call right now. Oriako, are you there?
Yeah, I'm there.
Good morning. Go ahead, please.
Good morning, first time caller.
Welcome to the show.
Okay, I just want to greet you for contributing a bit to what you are saying.
Thank you. All right. So just greet us.
Okay, I wanted to ask a question because based on the research, the test to confirm Lassa fever is only being done in Edo State. At least from Taraba, they had to send the blood samples to Edo State. Urua. So imagine if you can only get it done in Edo, how would people in Taraba and other smaller communities confirm that this is Lassa, or this is not malaria, or this is not typhoid. How do you differentiate?
This is a very, I don't know how to even start it. Like I keep on using the same word, edge system. In a situation where we have a nation where our leaders are still running out of the country, we are still going back there anytime. Then there's a big problem. I think the lab in Lut also could do the diagnosis. Yes, I think so with Ura as well. I think 1 or 2 other centers could do it.
In the country.
But wait, but you see, when the outbreak is in Taraba, a proactive government should have moved the team of what's it called, medical professionals that would test to be sure that these things is Lassa fever or is not Lassa fever. They should have moved them to, you know, to Taraba. It's not whether they now start sending blood sample.
Let me take this call from Prince. Prince, are you there? Prince, good morning.
Yes, good morning.
Morning, go ahead, please.
Yes, my question is for the doctor. You know, in this hospital, I will have those small people in the house. So most of them,
We're having trouble hearing you, Prince.
I said, in Lagos, we have pediatrics, and we have those small ones in the house that don't respect me. So which of those we are able to find them? That's what I'm talking about.
What is the timeline between when you're infected and when it now manifests to that point that it can no longer be treated? Because if they need to send samples somewhere, before the sample comes back, I hope the person is not dead.
The incubation period, that's the time between infection and when the person can start having the symptoms. And it's about between 6 days to 21 days.
Okay.
So, and what the person is at, before the person shows symptoms, actually, research have shown that the person cannot transmit. So we are safe when the person is not showing symptoms. One of the major symptoms we have, that's why I call Lassa fever, is a very high grade fever. You know, and the person is just hot and all that. I remember that when I was working at the National Hospital, there was an outbreak in Nasarawa, stroke Abuja then.
Should we drive?
I don't know. And then I remember some of our staff were actually infected.
Whoa.
Yes, but we are lucky. No, I was not. We were lucky. Maybe I used the word lucky that none of them died, because when you do the right thing, you can actually save those people.
Let me take this call from Joy. Joy, are you still there?
Yes, good morning.
Good morning, Joy. How are you?
I'm fine. I'm the first time caller.
Welcome to the show.
I'm sorry, please, I want to speak with Auntie Sophie.
Okay.
As in about the makeup stuff. I want to
You see her tweet. Send her a tweet.
Yeah, send a tweet and we'll reply.
But I don't have a tweet. I sent a message on your Facebook.
Okay, I'll reply to the message on Facebook.
All right, thank you very much.
All right,
So
so
send for me too. I want to.
let's take some tweets, please.
Okay. Most of the tweets are on our hot topic, and I don't blame them.
People don't feel Lassa fever because it's not in Lagos.
Yeah.
But
Hey, talking about Lassa fever now, because I know up north, a lot of people have cats. Most of the houses, you know, they have cats and
My
all that.
dogs killed all my cats.
So
They
now,
just killed the last
if
one.
a cat should go and eat a rat that can
As an infected
that
rat.
is-
Yes,
an
so
infected- does the cat?
that's the funny part of it.
I better tell
the
me.
rat itself is infected, but it's not showing any symptoms. The rats will not show, just like the Ebola. The
Yeah.
bat has the Ebola virus, no symptoms. The rat also in this case don't show any symptoms. Even if the cat eat the rat, no symptoms.
Okay.
That's
Let me
it.
take Yakub. Yakub, good morning. Happy New Year.
Yeah, same to you all.
Good morning.
And good morning to Doctor. Sister Annie, good morning, ma.
Good morning. Happy New Year.
Same to you, ma. Jimmy, Mama Adeji, one. Good morning to you all. You see, let me just say something about the last topic.
Yeah, go ahead.
You see, I quite agree with Sister Annie this morning. Morado, if you witness one time, if these people taking one will knock somebody down, you will agree with Sister Annie. You know what? If somebody knock human being down, then because of being knocked that person down, the person pass on and dies. So, and then you're not saying that the person should not go preach and then the cow, it should not be punished, it should not be sick. So who is going to bring that person's life back? So the person that you kill is already gone. And then you are not bringing a statement that you say if it is not inquire, maybe loss of life. Are you saying that earlier? If there is no loss of life, are you telling me the person will keep it taking one way until he knocks person down? So I agree with Sister Ellen. Good morning.
Thank you very much. Thank you very much. That's why I said
Back
they should
to
charge
the
them
matter.
with, wait, before you go back to the matter, they should be charged with attempted murder.
Back to the matter. So now in Taraba, now one of the we've had doctors come here and they've reminded us of the fact that one of the issues we've had in the northern parts of the country is that we lack that professional medical team. You know, that first response team. Even though we can't have all the experts everywhere in the country, but that initial team to at least be able to control the spread of this thing, of this virus. Now, how do you think it can be controlled in that part of Nigeria?
I mean, go back to say that's one of the things that worked for us in the case of Ebola.
Yeah.
It happened in Lagos. I bet if it had happened somewhere else, there would have been big trouble. You can remember then all hands has to be on deck. I remember that even my own department in Lut, we had all out of the place, getting to work in the airport, at the center, communication, all that. Even last suit, everybody. So that's why we're able to have what we have. And in this case now, I think the government have to start to treat the medical personnel well, so that we can have people that are ready to lay down their life for the nation and for the people doing their work. Now, prevention of Ebola, it's very easy. Of Lassa fever, it's very easy. One is just prevent the rat. Two, your food, there's what we talk about storing food in containers that's sealed, plastic containers and all that, not just leaving food anyhow and all that.
What of the gari? You know,
that they are selling in the market, they will now expose it.
Yeah, those are the things we need to work on. Just
so how do you even clean gari? You know, I always wonder, because I always see all these particles in gari. How do you even clean it?
I think when you like boil with very hot water or like a bar and all that, it should like kill the virus to a large extent.
Virus? Killed by heat?
Let's see about this because I always have that problem. When they bring gari for me from the up country, it has a lot of particles.
Yeah, that means that was not well prepared. If gari was well prepared, there should be no particles in there. Because people do it crudely and all that.
Trash it.
Okay, let me take this call. Babatune, are you there?
Yeah, I'm there.
Good morning.
Good morning, Mariah. Good morning, Styling. Good morning. Happy New Year.
Same to you.
Yeah. Quick one. I think if you stop that guy, then you are going to make an gentleman go longer. But I think what I observe in what the doctor is saying is still remains the fact that our government doesn't value our life as a citizen in this country. Because this thing is something that immediately the epidemic was declared there, they should have moved the experts to that side.
Yes.
Irrespective of whether we have the clinic that are in charge of such sickness there or not. You go abroad, outside the country, you will see people, once it's been declared like this, they have some emergency things. What is happening with us in this country? It is item that we just have to let these people. It's not about the money, it's not about the policy that they are sitting there and making there. It's all about the life of the people that vote them into these offices. These people do not value our life. In fact, I'm hearing this for the first time now. Despite the fact that I read newspaper. As they want Ebola to move away from Nigeria, why didn't they start the campaign of Lassa fever also? If not for your view, places like this, we won't be hearing them.
All right. Thank you so much.
Thank you very much.
Babatune.
Thank you very
Appreciate
much.
your call.
Yeah, and I can bet you that we are going to have a case or something in Lagos soon. Because once anything like that happens, all the time they have cases in other states, there must be at least a suspected case in Lagos. And I'm telling you very soon we're going to have it. So when Lagosians think that they are just fine, that's what we call active surveillance. That's the word in public health. When there's something anywhere else, and that's what we are preventing from the Ebola thing. If we have started active surveillance before we put any suspicions in Lagos. And that's what we have to start to do at the moment if we want to make sure everyone's fine. Yeah.
We have a lot of rats in Lagos. A lot. When you are walking the streets, you just see rats are strolling like human beings on the road. You know, even some...
Especially this your Magodo.
there are a lot of rats.
Let me confess, I have rats in my compound though.
How are we going to prevent? Because rats are... You know, I hate rats. I really, really hate rats. How do we prevent rats?
By cats.
And then, no, my cats, the dogs have killed my cats now too.
No, Makute can kill this one also. Makute cannot kill this one. There's some huge ones I see running around the gutters.
But I wanted to say something because you know you're saying about Lagos. Use of public
Let him
toilets.
answer the question
There's no
first.
to add to your question. Use of public toilets now, for instance, you know that the state of our toilets, public toilets are very, very, so is it possible that, when you go there to use and somebody that is infected use that toilet, can it also transmit, or it's not?
For human to human transmission, the people that should be too bother is the doctors themselves and the health workers, and maybe somebody that have the disease and a close person. But really, that might not be, when you look at problems and look at solutions, you will start from the one that's very close to you. Like what YK said about the rats is something we need to also look at, because that's one, because you might not know what type of rat, because you won't go and start carrying the rat and looking at
the breast.
whether it or something.
They can have any breast does he have?
So I think we have to do something.
How do we
about
generally?
the rats.
There's one particular rat that smells very terribly. Is that?
Yes, and that's the multi-marriage rat actually smells. So
sugar.
Yeah, we're close to that.
I think
dark and all that.
People should not conserve food, even if you are hungry. If you see that rat has eaten part of a yam, that's me. I'm very jebu. If rat eats yam, I cut out the part the rat has eaten and still cook the remaining.
You are not sure.
Now I need to stop.
Because when the rat eats it, maybe the rat has found it.
Maybe he has
I need to do that.
Maybe he has urinated on the
So you just trash the whole thing.
Yes.
That's what we have to do.
I don't do that.
Because
that place.
there was a time my house was heavily infested with rats, to the point that all the cereal I bought, everything, I just went shopping. Imagine you just going shopping and like 4 sachets of milk, the big ones, the sachet, I saw holes. I had to trash everything because the rat had, so I think people should not do Ijebu like Tope.
Another thing, I notice a lot of people don't do this. I do it a lot because ordinary, when you have your trash bags, ordinary plastic bags, those yellow and black ones, buy them. I buy the packets. I use it in my trash. If you want to buy the regular zip-up,
tie up your
trash. Use the regular. They just put the dump in the. They don't use their own bags. They just throw the trash in the basket and now throw it outside. That is so wrong.
Rats, they will go and
but if you tie it properly.
If it's tied properly,
they will change it now.
It's not that bad. It's not attractive anymore.
It's not even because in our estate now, the incinerator, they keep saying it that you must load up your trash in a bag, tie it up properly. Because the way you would attract rats is when the trash is just scattered all over the place.
So I always tell my house girl, no matter you buy those bags, they're like 100 in the void, like 600 naira or 300 naira. Buy them, put it in your kitchen
basket.
Use it in your kitchen.
Tie it up properly.
Tie it up. Make sure it's
and don't leave trash in your house overnight. Make sure you trash your
outside.
Your trash every
I hope
evening.
my house help can hear.
Please buy those things. 300 naira per packet. All right, Dr. Lalekon, thank you very much.
I wanted to ask
Thank you very much.
Oh goodness.
We should have treated
that's
that
all
different.
we can take on the show today. You can watch us again at 9, and you can check us on YouTube by going to YouTube/TV Entertainment and search for Your View. And you can also check us on TVC Connect, or please always tweet to us. That's our parent Twitter handle, and Facebook and TVC Connect, TVC, right? TVC Connect. So just look on Facebook, on Twitter, #TVC Connect, and you get all the details on all our stations. That's TVC International, TVC Nigeria, TVC Entertainment. All of us are there. You can check us out when you want to check us out. All right. See you tomorrow. Bye-bye.
Did I mention you look pretty today?
I know I do.